All right, friends, so today we're going to talk about peritoneal endometriosis. Remember, there are three types: peritoneal endometriosis, endometriomas, aka chocolate cysts, and the deep infiltrating endometriosis. I'm excited to dig into this specific type because it does not get talked about a lot. It typically gets overshadowed by the others. And one of the major myths is that women or people who suffer from superficial peritoneal endometriosis do not experience pain. That is not true. So I want to highlight that. So let's break down the peritoneum, right? When you're talking about the peritoneum, we're just looking at some notes. It's the membrane that surrounds and supports the abdominal organs. So we're talking about the uterus, we're talking about the ovaries, we're talking about the bowels, right? Key things, the bladder as well. These are the places where endometriosis loves to just rage like a wildfire, and that is very key. One key difference of peritoneal endometriosis and endometriomas, when you're talking about endometriomas, you're talking about deep lesions and cysts. Now, remember I said when you're talking about peritoneal endometriosis, you're talking about more tissue surface. It's more on the surface of the tissue, so it's not deep, but that does not mean that it does not cause pain. I do not want people to get confused with that. So the typical areas that are affected by peritoneal endometriosis, you have the posterior cul-de-sac, which is the space behind the uterus. So for some women, it's like their uterus is tethered backwards. Adhesions, friend. Literally, it's restricting your uterus and it causes a lot of problems. And honestly, I have a very high suspicion of it. Uterine ligaments literally can be bound by adhesions pertaining to this specific type of endometriosis. The rectal uterine pouch, the area between the uterus and the rectum, that's where I have my highest suspicions. I have suspicions of rectal endometriosis. Typically, you have to pay attention when your menstrual cycle comes on, when these lesions begin to bleed, and the symptoms that you experience. When I have bowel movements, TMI, we're all grown. I'm not about to sit here and just edit that part out, right? I have rectal spasms and I feel like I'm in full-blown labor, having full-blown contractions, but in the rectum area. Very uncomfortable, very painful. It makes me cry, but it only happens during my menstrual cycle. So that's what's leading me to the suspicion that I may have some lesions in this area. The fallopian tubes, right? Come on now. You have a lot of women who are suffering with infertility. 9 times out of 10, they probably are dealing with undiagnosed endometriosis. Bladder and bowels. Yeah, I said it, bladder and bowels. These are places that you would not even think of endometriosis to be, but they are present. All right, now we gotta take a pause. Gotta get your Gatorade. This keeps my blood pressure up. Now, let's go over the lesions. This is very key and very important. These lesions are very small, so they do not typically get picked up on imaging, and that is how they're missed. So you can have women suffering with peritoneal endometriosis get tons of imaging, MRIs, ultrasounds transvaginally, and they're being told, oh, your imaging is normal, we don't see anything, you're fine, but yet the woman still leaves in pain. So, like I said, most of these lesions are small, and they also range in different colors. So you have red or purple, which are the early stages, often referred to as fresh lesions, and they appear as red or purple spots. And these are basically areas that are active and inflamed. Then you have blue or brown spots, right? Older lesions that have been in place for a longer time tend to appear brown. White or clear. In some cases, white or clear lesions may appear, especially in cases of scarring or adhesions. So this is very, very key. I butchered this word, laparoscopy. Your girl was calling it laparoscopy. Laparoscopy is the gold standard for diagnosing and treating endometriosis. So for most women, they're not probably going to figure out that they have superficial peritoneal endometriosis until they get a laparoscopy done. Factor, sometimes these lesions can appear flat and sometimes they look like nodules. I have met a couple of sonographers that know how to spot superficial peritoneal on imaging. So just throw that tidbit in there. Let's go over some symptoms of peritoneal endometriosis. Pelvic pain, friend. This is the issue when you're battling chronic illness, because a lot of the times if you have syndromes, your multiple syndromes, symptoms overlap. I have pelvic congestion syndrome. It causes pelvic pain. I have adenomyosis. It causes pelvic pain. But guess what? Endometriosis also causes pelvic pain. So it makes it harder for you to advocate for yourself when you're trying to figure out what is the causation of my pelvic pain, right? Painful menstruation. Once again, pelvic congestion syndrome and adenomyosis does the same thing. But this is another gold sign of endometriosis, right? Pain during intercourse. Unfortunately, your girl, I suffer from that. It does not take away from my pleasure. By the way, I've learned to kind of maneuver around it. But that isn't, sex is not supposed to be painful. Let's just throw that out there, right? Painful bowel movements, as I mentioned before, that's not normal. Infertility, as we mentioned before. There are a lot of women who are infertile, unfortunately, due to endometriosis. And it just sucks, you know? It's literally blocking women's ability to bring forth life, right? Abnormal bleeding. You're going to deal with a lot of heavy bleeding. Those lesions are bleeding, friend. And depending on how many lesions that you have, and depending on what type you're dealing with, it controls the type of bleeding that you're forced to deal with, unfortunately. And nausea, uncommon symptom. The key thing that I paid attention to is women have taken the time to explain their symptoms to their doctors, and it's getting ignored. They're not acknowledging it. They're telling women that this is normal. I'm here to tell you it's not. Let me say it louder. It's not normal, okay? So if you are somebody who has a diagnosis of superficial peritoneal endometriosis, please hop in the comment section and share how you got your diagnosis. How did you get doctors to listen to you? If you are somebody who has suspicions of peritoneal endometriosis like I do, post your questions, concerns in the comment section. I want people to kind of interact with other people and build a network. That's how we're going to help people. I do not have enough knowledge in this area. I'm learning myself simply because I have suspicions of it. So I could use the input from those who've been battling it for a very long time. And as I always say, I'm gonna end each and every last one of my videos. As you're advocating for yourself, keep this in mind. No is a whole word that deserves to be respected.